Marburg hemorrhagic fever is a rare but deadly disease. It is a viral infection that causes severe bleeding and organ failure. The disease is highly contagious and often fatal. Marburg hemorrhagic fever was first identified in 1967 in Marburg, Germany. There have been several outbreaks since then, mostly in Africa. Marburg hemorrhagic fever is a serious public health concern. It is important to be aware of the disease and how to prevent it. This essay will discuss the symptoms, transmission and prevention of Marburg hemorrhagic fever. It will also provide information on the latest outbreaks and travel advisories. The virus that causes Marburg hemorrhagic fever is a close relative of the Ebola virus. Both viruses cause similar symptoms including fever, headache, muscle pain and bleeding. There is no cure for Marburg hemorrhagic fever, and treatment is primarily supportive. Marburg hemorrhagic fever is a serious threat to global health. It is important to be aware of the disease and take steps to prevent its spread. If you are traveling to an area where Marburg hemorrhagic fever is present, be sure to take the necessary precautions. Marburg virus disease, or MVD, is a severe and often fatal illness in humans. The Marburg virus, a filovirus, is the culprit behind this devastating disease. This virus is closely related to the Ebola virus, and both belong to the Filoviridae family. MVD poses a significant threat to public health due to its high fatality rate and the lack of approved vaccines or antiviral treatments. The Marburg virus finds its natural reservoir in fruit bats, particularly the Egyptian rosette bat, also known as Rosetus aegyptiacus. These bats harbor the virus without showing any signs of illness. Human infection typically occurs through exposure to mines or caves inhabited by these infected bats. Direct contact with the bat's bodily fluids, such as saliva, urine, or feces, can lead to transmission. Human-to-human transmission of the Marburg virus occurs through direct contact with bodily fluids of infected individuals. This includes blood, saliva, vomit, urine, feces, and semen. Transmission can also occur through contact with contaminated objects, such as needles, syringes, or medical equipment. The Marburg virus enters the body through mucous membranes, cuts, or abrasions in the skin. It can also be transmitted through sexual contact or from mother to child during pregnancy, childbirth, or breastfeeding. Once inside the body, the virus replicates rapidly and spreads throughout the bloodstream, leading to a range of severe symptoms. The symptoms of Marburg virus disease typically appear suddenly after an incubation period of 2 to 21 days. The initial symptoms are often nonspecific and can mimic other febrile illnesses, making early diagnosis challenging. Fever, chills, headache, and muscle aches are common early signs of infection. As the disease progresses, more distinctive symptoms emerge, often within a week of the initial onset. A maculopapular rash, characterized by flat, red areas on the skin that may be covered in small bumps, is a characteristic symptom of MVD. This rash usually appears on the trunk, chest, and back. Gastrointestinal symptoms such as nausea, vomiting, abdominal pain, and diarrhea are also common. Severe cases of MVD can manifest with life-threatening complications. Jaundice or yellowing of the skin and eyes may indicate liver involvement. Pancreatitis, inflammation of the pancreas, can cause severe abdominal pain. Significant weight loss, delirium, and confusion can occur as the disease progresses. In the later stages of the disease, hemorrhagic manifestations may develop, leading to bleeding from various sites. This can include bleeding from the gums, nose, eyes, and gastrointestinal tract. Internal bleeding may also occur. Multi-organ dysfunction, including liver and kidney failure, can lead to shock and death. Diagnosing Marburg virus disease, or MVD, presents a significant challenge due to its initial nonspecific symptoms, which overlap with other common tropical diseases like malaria, typhoid fever, and Lassa fever. To confirm a suspected case of MVD, laboratory testing is essential. Several laboratory tests can be employed to diagnose MVD. These tests aim to detect the presence of the virus itself, its genetic material, or the body's immune response to the infection. Polymerase chain reaction, or PCR, is a highly sensitive and specific test that amplifies and detects the virus's RNA, providing a definitive diagnosis. Antibody capture enzyme-linked immunosorbent assay, or ELISA, detects IgM and IgG antibodies produced by the body in response to the Marburg virus infection. Antigen capture. ELISA detects the presence of Marburg virus antigens in blood or tissue samples. Virus isolation involves culturing the virus from patient samples in a laboratory setting. providing a definitive diagnosis but requiring specialized facilities and posing a high biohazard risk. Timely diagnosis is crucial for implementing appropriate infection control measures, initiating supportive care, and potentially improving patient outcomes. However, the limited availability of diagnostic facilities, especially in resource-limited settings where MVD outbreaks often occur, poses a significant obstacle to early and accurate diagnosis. Section 5. Combating the invisible foe: treatment and management of Marburg hemorrhagic fever. Currently, there is no specific antiviral treatment or vaccine approved for use against Marburg hemorrhagic fever. Treatment primarily focuses on providing supportive care to manage the symptoms and complications of the disease. One of the cornerstones of supportive care is maintaining the patient's hydration status. Intravenous fluids are often administered to replace fluids lost through vomiting, diarrhea, and bleeding. Electrolyte imbalances, which can be life-threatening, are carefully monitored and corrected. Oxygen therapy is crucial for patients experiencing respiratory distress. Mechanical ventilation may be necessary in severe cases. Blood transfusions may be required to manage severe bleeding and anemia. Secondary infections are a common complication of MVD. Broad-spectrum antibiotics are often used to prevent and treat these infections. Pain management is also an essential aspect of supportive care, and analgesics are administered to alleviate the patient's discomfort. Section 7. The Unfolding Crisis: Recent Outbreaks and Travel Advisories. As of December 15, 2024, the most recent outbreak of Marburg virus disease occurred in the Republic of Rwanda. The outbreak, first reported in September 2024, raised concerns due to its rapid spread and the involvement of healthcare workers. According to the World Health Organization, or WHO, as of October 2, 2024, Rwanda reported 36 laboratory-confirmed cases of MVD, including 11 deaths. The outbreak originated in the southern province of Nyamagabe and quickly spread to neighboring districts. At least 19 healthcare workers were among those infected, highlighting the importance of stringent infection prevention and control measures in healthcare settings. The Rwandan government, in collaboration with international health organizations, implemented swift response measures including contact tracing, isolation of suspected cases, and public health awareness campaigns. The Centers for Disease Control and Prevention, or CDC, issued a Level 3 travel health notice for Rwanda, advising travelers to avoid all non-essential travel to the affected areas. The notice emphasized the importance of taking precautions to prevent mosquito bites, as mosquitoes can transmit other diseases such as malaria, which can complicate the diagnosis and management of MVD. Section 9. Stay informed, stay safe. Reliable information sources for Marburg hemorrhagic fever. Staying informed about Marburg hemorrhagic fever is crucial for protecting yourself, your loved ones, and your community. Reliable and up-to-date information can help you make informed decisions about travel, prevention, and seeking medical care. Several reputable organizations provide accurate and timely information on Marburg hemorrhagic fever. The World Health Organization, or WHO, is the leading international authority on public health. Their website provides comprehensive information on MVD, including outbreaks, travel advisories, and prevention tips. The Centers for Disease Control and Prevention, or CDC, is the national public health agency of the United States. Their website offers detailed information on MVD, including symptoms, transmission, diagnosis, and treatment. Your local health department can provide specific information about MVD risks and prevention measures in your area. They can also answer your questions and address your concerns about the disease. By staying informed and following the recommendations of these organizations, you can help protect yourself and others from the threat of Marburg hemorrhagic fever. Remember, knowledge is power, and in the fight against infectious diseases, it can be the difference between life and death.